Senator Tom Coburn and some of his Republican colleagues unveil a health care plan. Hi, I'm Chris Castile in the Washington Bureau of the Oklahoman. Senator Coburn and some of his fellow GOP lawmakers said today that they agree the nation's health care system needs a major overhaul. But their approach is much different than the one that's expected to be offered by the White House and Democratic congressional leaders. The big difference? Coburn and his co-sponsors want everyone, except for the elderly on Medicare, to have a private health insurance plan. That includes people who now get insurance through Medicaid. It is expected that the Democratic proposal will include a government insurance plan, but Coburn says that will drive people away from private insurance.
Why would anybody buy insurance where it's higher when they can buy it from the government? So that means the Lewin numbers are going to be absolutely correct. About 120 million people are going to go to a government plan. Except we know how we run health care, and we will not sustain it.
Healthcare reform is an extremely complex issue. There are so many different pieces. The insurance companies, the hospitals and doctors and drug makers, the state and federal programs, and the tax implications. The Coburn proposal does take aim at the tax break that workers get from employer-sponsored health insurance. It would be eliminated. That means the value of the insurance would be subject to income taxes. But Congressman Paul Ryan of Wisconsin says employees would get a tax credit that would more than make up for that.
We propose to equalize the tax treatment of health care, giving every American, regardless of employment status, the ability to purchase health insurance. And if you like what you've got, you can keep it. If you like what you have at your job, you can keep it and apply your tax benefit to that. This will result in for a vast majority of Americans in a net tax cut.
The Republicans claim that their proposal won't cost the government any more than it's now paying for medical programs, and that an automatic enrollment feature would get young, healthy people into the insurance pool and bring down the costs for everyone.
Our plan attempts to bring more people under the coverage umbrella in private insurance, therefore spreading the risk amongst many more Americans.
Congress is expected to spend a good portion of the summer debating health care, and it's not known how much attention this Republican proposal will get. The lawmakers said they have contacted governors about it, and Coburn said he talked to President Barack Obama about it recently personally. Coburn, a doctor, said health care decisions need to be made by patients and doctors.
I would remind you that health care is about people, not programs. And if you look at where we are today in terms of the programs that we have for health care, the ones that are failing the most are the ones that are run by the government, whether it's VA care or Indian health care or Medicaid and certain aspects of Medicare. So the focus has to be on individuals, and it has to be on how we enhance individuals to make great choices for themselves and give them the freedom to do that.